Okay, I just wanted to have a little talk to you both before you go home, just about what your diagnosis was and also a few other things about your discharge. The reason you were actually admitted was because you were a little bit confused, and they actually diagnosed you with something called a delirium. Delirium, yeah. How we tend to describe delirium is that it's somebody is confused just for a very short period of time, and it's always because there's something wrong, so an infection, or in your case it was because you were quite dehydrated or you hadn't been having enough fluids. Enough to drink, yeah. And also I think that you were constipated as well, so that added to that as well. So that was the sort of the cause of the reason that you came into hospital. So I'll give you some information about delirium that you can have a look after with your daughter. Right. And that just explains it a little bit more as well.
Okay, I'll take that, Dad.
And I think the really important thing is that so you don't have a delirium again is that you try and keep drinking as much as you possibly can. And I know that you don't like to drink water, but maybe maybe there's some other things that we can look at getting you to drink apart from your tea. What else do you think you like? Any juice or cordial?
I could try some cordial.
Yeah, cordial would be good.
Yeah, that would be okay.
Yeah, and even things like icy poles or icy poles, like
an ice block, Dad.
An ice block
Ice
with
block.
fluids, yeah.
Oh, okay, yeah, I like those.
Yeah. So it's just important to think about the fluids and the amount of fluid that you're drinking, and that will help with your constipation as well.
Okay.
Yeah.
That'll be good, Dad. We can do that.
And try and keep on top of that constipation, and you can talk with your GP about the best way to manage that as well.
Yeah, okay.
Yeah. The other thing I was thinking is maybe we could get somebody to come in and review your medications at home, to have a look at your tablets and make sure that they're the right tablets for you.
Well, Chaz can do that.
Yeah.
I can look after that. I'm sure that'll be fine.
Yeah.
Look at
All right.
what the doctor's ordered.
Yeah, that'll be good. And it's important too that if you see any changes in your dad, that you take him straight to the GP so that we can assess and monitor you, so that you don't get as unwell as you did before coming into hospital. Because the GP is always there to support and knows you well, so it's important to go there.
Yeah, I don't remember much about it.
No, with this information I can see that if there's anything wrong
that's
with
right.
Dad. That's right.
All right, that
I
sounds
can
good.
still drive?
Yes, you can still drive because you've improved. You were really unwell when you first came in, but now that's resolved. Yeah. All right.
Do you understand everything, Dad?
I think so.
Yeah.
That's good.
All right. Sounds good.
Okay, thank you.
Okay.
We can go now, can we?
We can go now.
Yeah.